Are you struggling with proteinuria or chronic kidney disease, CKD, and wondering if there's something more you could be doing? If you've ever asked yourself, can vitamins make a difference for my kidneys? You're not alone. It's a question that leaves most of us scratching our heads. Now, you've probably heard that vitamins are essential for our bodies. But when it comes to kidney health, not all supplements are beneficial. Some could be doing more harm than good, especially if they contain minerals like potassium or calcium, which can increase the risk of kidney stones. So you think you're helping your kidneys, only to find out you're adding to the problem. What vitamins should you be taking? Today, we'll be diving into the top 5 vitamins that not only help stop proteinuria, but also heal your kidneys. These vitamins can support your kidneys. But before we get there, ask yourself, are you sure you're not unknowingly putting more strain on your kidneys by taking the wrong supplements? In this video, we're going to clear that up and give you the full lowdown on what works best. So, stick around to the end. And, while you're here, give this video a like and subscribe to this channel. You'll want to be the first to know when we drop more health tips like these. Now, let's get started and see exactly which vitamins are on the must-have list for your kidney health. 5. Vitamin D. Vitamin D is a vitamin you probably associate with sunshine or strong bones. But did you know that your kidneys are necessary to how your body processes this vitamin? When there is insufficient vitamin D, there could be a corresponding increase in proteinuria in the body. A study took a group of CKD patients, people who were already on standard treatments like ACE inhibitors, which help control blood pressure and proteinuria, and split them into 2 groups. One group just kept taking their usual meds, while the other added a low dose of vitamin D. And what do you think happened? Over 24 weeks, the group that added vitamin D saw a significant drop in protein levels in their urine. And for those who had low vitamin D levels to begin with, the results were even more complex. The message is simple. If you're lacking in vitamin D, your kidneys might be suffering. There's yet another benefit of this vitamin. It suppresses something called the renin-angiotensin-aldosterone system, RAS, which means it helps calm down an overactive system that, if left unchecked, could accelerate the progression of CKD. Imagine you're driving a car with the gas pedal stuck down. RAS is like that accelerator that's pushing your kidneys faster toward damage. Vitamin D comes in and acts as the brake, slowing things down and giving your kidneys a chance. It has also been shown to help lower blood pressure and improve insulin sensitivity, both of which are important for kidney health. So, if you're dealing with kidney issues or trying to prevent them, maybe it's time to talk to your healthcare provider about where your vitamin D levels stand. 4. Vitamin B9. First, let's break it down. Folate, sometimes known as vitamin B9, is more of a multitasker vitamin. It helps build and repair DNA, which is the blueprint of every cell in your body. It's like the body's own construction and repair team. Recent research suggests that vitamin B9 boosts your immune system by supporting neutrophils, which is a type of white blood cell that's on the front line fighting off infections. Researchers studied over 8,000 people who had high blood pressure but no signs of kidney damage at the start. They split them into 2 groups. One group took a blood pressure medicine called enalapril and folic acid, vitamin B9, while the other group took only enalapril. It turns out that folic acid made a huge difference. In the group taking both enalapril and folic acid, the risk of developing proteinuria was cut in half, especially in those with higher neutrophil counts. But for those who only took enalapril, the risk of kidney damage increased. Now, let's step back for a second. Think about it. You have a common, affordable vitamin that, when paired with the right blood pressure medication, can not only help manage your blood pressure but also protect your kidneys from long-term damage. The next time you come across vitamin B9, don't just think about it as another vitamin. It can fight to keep your kidneys healthy, especially if you're managing high blood pressure. 3. Vitamin E. Vitamin E is more than just something you see in your multivitamins. It's a potent antioxidant with strong anti-inflammatory properties. So, how does this relate to your kidneys? In your body, there are things called reactive oxygen species, or ROS for short. They are like little sparks that can burn through your cells and set off damaging chain reactions. For your kidneys, these sparks can be especially dangerous because they damage the delicate structures that help your kidneys filter waste. When ROS levels go up, they can trigger the creation of harmful compounds and disrupt important functions that control blood flow to your kidneys. If this damage adds up, it can make it harder for your kidneys to do their job properly. Vitamin E neutralizes these ROS sparks before they can cause trouble, acting like a shield to protect your kidneys from cell damage. This is why researchers believe that higher levels of vitamin E could be associated with a lower risk of proteinuria. While research is still ongoing, one thing is clear. Make sure you get enough vitamin E daily, about 12 to 15 milligrams, from sources like seeds, nuts, and edible oils. It might be a small but impactful step in protecting your kidneys. 2. Vitamin B3. Why should you care about niacin if you're dealing with CKD? For people with CKD, high phosphorus levels can worsen kidney damage over time. Vitamin B3 or niacin steps in by blocking phosphorus from being absorbed in your digestive system, which helps lower the amount of phosphorus that could harm your kidneys. This vitamin can also help your kidneys bounce back from injury by boosting something called NAD+, a molecule that powers up your cells. When your kidneys get injured, NAD+ levels can drop, leaving your kidneys without the energy they need to heal. Niacin steps in and replenishes NAD+. It refuels your kidneys when they need it most. Are you still there? Good. Now, let's look at what the science has to say. In a study conducted on CKD patients, those who took 500 milligrams of niacin daily for 6 months experienced some good changes. Their HDL cholesterol, which is the good cholesterol, increased. Their triglycerides, the fats that can clog your arteries, went down. Most impressively, their serum phosphorus levels dropped, which helped protect their kidneys from further damage. Now, if you're wondering about side effects, only about 8% of patients had issues with niacin, and most handled it just fine. So, it's a low-risk, high-reward way to potentially slow down kidney damage and boost overall kidney health. 1. Vitamin B12. Vitamin B12 is absorbed in your intestines with the help of a special receptor called cobalamin. Cobalamin is like a little helper in your body, making sure you get enough vitamin B12 from your food. But cobalamin has another job as well. In your kidneys, it helps reabsorb proteins and keeps them from leaking out in your urine. So, what happens when your vitamin B12 levels are out of balance? When you don't have enough vitamin B12, you might feel really tired and could develop anemia or even nerve problems. Also, B12 helps break down a substance called homocysteine in your blood. If your B12 levels are low, homocysteine can build up, which increases your risk of heart disease. A recent study of over 31,000 patients found a strong link between high B12 levels and increased protein in the urine. So even though B12 is good for health, too much could actually add stress to your kidneys. If you're considering a B12 supplement or already taking one, it's best to do so with a healthcare professional's guidance, especially if you're keeping an eye on your kidney health. Now, before you rush to stock up on these vitamins or any other supplements, let's hit pause for a moment. Remember, when choosing a supplement that's right for you, consulting your doctor is necessary. This is especially true if you have kidney issues or are at risk for them. We're saying that if you're taking supplements, you need to be mindful, especially if you have or are at risk for kidney issues. Following your doctor's dietary recommendations is important. Vitamins, like anything else, need balance. Too little can lead to deficiency, and too much could have unexpected side effects, particularly for your kidneys. And that's a wrap for today, folks. If you found this information as enlightening as we did, give this video a thumbs up and subscribe to our channel. Your health journey deserves all the right tools, and we're here to equip you with knowledge that can truly transform your life. See you in the next video.